Today we're talking about how oral health can impact everyday life, from feeling confident when you smile to being able to eat comfortably. For anyone who has ever felt held back by dental issues, this conversation is for you. We're joined by Dr. Andrea Joy Smith and Dr. Melanie Marshall to talk about patient experience and oral health right here in Sacramento. Welcome to you both. Thank you so much for joining us today.
Thank you.
Good morning, Desiree. Thank you for having us.
Yes. Okay, Dr. Smith, we're so used to seeing you, and you've brought in someone special with you today. So can you tell us, can you introduce Dr. Melanie Marshall to our viewers and share what she'll be bringing to your practice and the Sacramento community?
I would love to. Dr. Marshall is a very special person in my life. She is actually my niece. She's been practicing dentistry for over 15 years, and I am just thrilled to have her join our practice, and I want to welcome you to Sacramento, Dr. Marshall.
Well, thank you so much.
Yes, welcome to Sacramento. And Dr. Marshall, for people considering one-piece dental implants, can you simply explain how these implants are installed? What does that process look like and feel like for a patient as we're looking at some of them here?
So the patient can expect to be numb during the procedure. We use these one-piece implants to do a variety of things. One of the things is we would help to stabilize a lower denture. So we would place the implants directly into the gums and through the gums and into the bone. And by not having to cut open the gums, we allow the patient to heal faster, and they're able to immediately use their teeth. When we do the stabilization, we have these little snaps on the inside of the denture, and we're able to snap in the denture for the patient. We also use them to replace just one single tooth or multiple teeth on this example. Yeah. And we find that the patients really have a good experience because they don't have to have their gums cut open.
Yes, and it's nice to see that visual demo of how that process takes place. And Dr. Smith, you brought some before and after photos. Can you describe some of the transformations that we're seeing in those before and afters?
Absolutely. I transform lives really every single day. Wow. And sometimes the patient has a similar story. Patients have not been able to smile in years, and with the simple use of one-piece implants, we're able to restore their smiles, restore their confidence, and they often cry when I deliver those smiles.
Okay, and you're not just here to talk about it. We actually have a client testimonial, so let's take a look at that.
All right.
I absolutely hated that my teeth could be taken out. They were full-on top and bottom dentures. It was just unnatural. I was very self-conscious, and the whole process of even getting used to them was so painful. The implants are like I have my regular teeth back. Just to have something permanent is such a game changer. To bite into an apple, you know, was one of the biggest things that I wanted to do because I could never eat apples when having dentures. It's just like having my regular teeth. It's just awesome.
I mean, we heard the confidence that brought her. And I mean, the first step is actually going into the dentist's office. So Dr. Marshall, many people, they might be a little hesitant to come in. They have those fears going in. So how do you both create a calming, comfortable experience from the moment a patient walks in?
What we like to do is we meet the patients where they are. We know that they're fearful. We sit down with them eye to eye, and we just start discussing the procedure or whatever is planned for them. The great thing is that we offer sedation dentistry. So we would give a prescription for the patient to take the night before so that they're able to sleep. They kind of get those jitters out. And then when they come into the office, we just kind of greet them with a nice, calm environment, and we also give them additional medications for them to take while we monitor them. And often our patients fall asleep because they're so relaxed. It just kind of takes the anxiety away from the entire procedure.
Yes, I would love to fall asleep during all of that, so that sounds great. And then Dr. Smith, once someone has had that procedure done and they heal, how do one-piece implants change the way they eat day to day, and what's the difference between getting through meals and truly enjoying them? Because we heard in that testimonial, she said, I can finally eat an apple.
That's right. Everything changes. Everything from smiling to kissing, really. When they start off wearing dentures and they go to not wearing dentures anymore, or dentures that no longer slip, their entire confidence changes. It allows them to eat better. Even it allows them to eat healthier, because now they're dealing with healthier teeth that can actually chew their food, because a lot of issues can be brought on by digestive problems for patients that have not been able to adequately chew. So confidence changes, lifestyle changes, the ability to eat. And I even had one patient told me now he can feel comfortable when he's invited out to dinner. And so those are things that some of us take for granted, but their whole lives actually change, not just the smile.
Yeah. Dr. Marshall, what's a food that patients tell you they're most excited to go back and eat again once they get these one-piece implants in?
I think they're usually most excited about corn on the cob,
Yes.
a crisp apple, and even a steak.
Yeah.
Yeah.
Just not having to worry about it anymore, right? They can just go and live their lives. Thank you both for joining us today and filling us in on one-piece implants.
Thank you for having me.
Thank you for
Yes,
having
of
us.
course. I'm going to let our viewers know where they can go for a little bit more information. Smile with ease and eat what you please. Learn more by heading to smileagainnow.com, or you can call 916-482-8300.